Talk about some other, you talked about kids in the juvenile justice system. Who are some other groups that clinical social workers might work with, or other settings that clinical social workers might work in?
Well, I think this is my passion and what's very exciting for me. I think sometimes there's a tendency to want to narrowly define clinical social work practice to be outpatient mental health services on a 50-minute clinical hour.
Right.
And I think that's an important part of the work, but only one of many possibilities. And the way that I define clinical social work practice is it's not the setting that you're in, it's the lens that you're bringing to your setting. And it's very interesting working with students because some will come in and have very strong presuppositions about what clinical work
this
is,
is supposed to look
what
like.
clinical social work is. But I think my passion and my heart is in the fact that clinical social work happens in a variety of settings. As I mentioned earlier, my background has been the criminal justice system, so I've done clinical social work in prisons, I've done it in day treatment programs, I've done it in community-based groups, I've done it in probation and parole, all kinds of non-traditional thinking when it comes to clinical social work. Certainly it occurs all the time in hospitals. I can't think of a time when people would need a clinical social worker more than when they're experiencing the trauma of learning of a new diagnosis or having a major accident occur or knowing that one of their loved ones may be passing.
Right.
Also in school settings, I think social workers, clinical social work is such a key piece, in particular in helping the school understand the behaviors from a mental health lens and not just responding to them as though you have an acting out child who needs to be expelled. So I've seen a lot of advancements in that area. It certainly happens on the streets, working with the homeless population. We have such a large number of people with significant mental illness who are also homeless. And of course, the two go together. So really helping law enforcement and other key participants to understand, why this person might be behaving this way and what we can do to support them to stabilize. Working in day treatment centers with, young kids, 3 and 4 and 5 years old, trying to make those changes in their lives. There's hardly a place where you can't do clinical social work. And it's really about a perspective and a lens, weaving in those values and ethics, but also the clinical competencies